You're listening to Nutrition Matters Podcast with Paige Smathers, registered dietitian nutritionist.
Hi everyone, it's Paige Smathers. Thanks so much for being here. Nutrition Matters Podcast explores what really matters in nutrition and health with a sensitive and realistic approach. To help support the podcast, please consider making a donation at positive-nutrition.com/podcast. If you find this episode interesting, engaging, or helpful in your life, please consider donating, sharing with friends and family, and leaving a review on iTunes, Stitcher, Google Play, whatever podcast app you use to listen to this podcast. You can leave a review about this podcast straight from your podcast app. Search Nutrition Matters Podcast, click reviews, and then write a review. You can also find me on Instagram and Facebook if you'd like to have a little more food for thought. Thank you for listening. Hi everyone, thanks for joining me for another episode of Nutrition Matters Podcast. My name is Paige and I'm your host, and today I'm speaking with Migrit Fletcher, who is a registered dietitian and a certified diabetes educator who has worked in diabetes care since 1995. She's written a few books and she talks about them during the podcast episode, and she has this really unique expertise where her passions for mindfulness and for meditation kind of are intersecting with diabetes care, and it's such an important conversation to have. And what we do in this episode is we talk about how mindfulness can totally benefit your health. Whether you have diabetes or you don't, you're going to want to listen. And then we kind of put to rest some of the most common misconceptions people have about diabetes and about maybe a compassionate approach to health. So we talk about all of those things and kind of help you understand where the misconceptions lie and really clarify what this whole mindfulness thing is about. I think you're going to really enjoy this. She's a fabulous speaker and she has so many great things to share. So thanks so much for joining me for this episode. So I also want to just mention I am making a really concerted effort to be more present and focused in the Facebook group we have about the podcast. So if you're interested in joining that group, it's a couple hundred of us there right now. It'd be awesome to have more people so that we can discuss things and support each other through this process of trying to create a healthy relationship with food. So that is Nutrition Matters Podcast Community on Facebook. Thank you to all of those of you who have so graciously left a review for the podcast. It's really appreciated. If you haven't had time to do that yet, if you're able and willing, we would really appreciate just a quick review on iTunes. Makes a big difference for us. And then also, if you're local to Salt Lake City, my new dietitian that I've hired, Katie, we have a whole episode devoted to her called Is Food Medicine? She is taking on new clients both in person and virtually, so check that out. See if her and her expertise might be a good fit for you. Go to positive-nutrition.com, click on Make an Appointment, and you can book an appointment with Katie or with myself. And as always, we're just so glad you're here, and I'm always just so excited to be able to share episodes and conversations that I've had with fabulous people. I feel really lucky and grateful to be able to do this work, and I'm grateful for all of you who support it through kind messages and through reviews or even donations. All of that stuff is really, really genuinely appreciated. So before we get into this podcast, I want to also mention we talk about mindfulness, and at one point I kind of define what this is a little bit, and we talk about how it fits into the broad picture of intuitive eating and of health at every size and some of the other stuff we talk about on this podcast. But right before we get into it, I just want to make sure everyone listening knows, for the intents and purposes of this podcast episode, you can kind of lump a lot of those terms in together. They all fit together in the big picture of a compassionate approach to health and creating a healthy relationship with food and your body. So just wanted to clarify that before we get in. And then I really, really hope you enjoy this podcast episode about diabetes and how you really can practice mindful eating with a diabetes diagnosis. I'd encourage you to share this with anyone in your life who maybe has diabetes or if you has questions about it, I think this could be really helpful for providers and patients alike. So with that, let's get into the episode, and I sincerely hope you enjoy it. Migrit, welcome to Nutrition Matters podcast.
Thank you for having me.
You're so welcome. And really, thank you so much for giving us your time. Let's just take a minute and introduce you and your work to my audience really quickly, and then we'll dive into talking about this really important topic that we have planned for the day.
So I'm a registered dietitian, diabetes educator, and about 2 decades ago, I decided to really have a formal meditation practice. So I dabbled in meditation like a lot of people do, and I decided to really commit to that practice. And as I committed to meditating and being in the present moment, I really noticed that the concepts and the things that I was learning about myself as I learned how to really listen, it transformed me, and it transformed my relationship with food. Now, keep in mind, I was a dietitian at the time that I started doing this, but I really found places where the compassion and the embracing of the present moment, it really wasn't something I had ever thought to do with food and eating. And that experience kind of opened my eyes to a different way of approaching nutrition. And I would talk to my clients about it, and they'd say, this is really helpful. I love this. I love talking with you. You're very different than other healthcare professionals. And as I thought about what they said, and as I worked with them, I decided maybe I should write down these little tools and techniques that I'm using. And I started writing some down, and at the time, the internet was just kind of emerging, and I did a search, and I found this gentleman. His name is Fred Bergrath, and he had kind of had the same experience that I had. He had written it all down as well, and I read his work, and I said, Fred, this would be great. We could adapt this for healthcare providers, and I think it would be really well received. He said, oh, okay, let's do it. So we worked on this first book that I wrote with Fred called Discover Mindful Eating. And it was handouts. Fred and I both have a master's degree in education. And the Discover Mindful Eating book, which I wrote with Fred, really launched me in a very different direction as far as a dietitian goes. And it really kind of brought me to the desire to bring mindfulness and mindful eating fully into my professional practice. And then, we can go on about how it led to other opportunities as well. I was a dietitian and a diabetes educator at the time. So as you can see, mindfulness, nutrition, diabetes, they all kind of converged for me.
This is a topic that I think is so important, and this is why I wanted to have you on, was just you found this beautiful way to marry the diabetes education world with this idea of mindfulness and mindful eating. And I think it's such an important intersection, as we'll dive into and talk about the nuances. But just from a kind of zoomed out perspective, a lot of people who have, let's say, diabetes as a health concern or other health concerns going on, they might hear all the rhetoric about intuitive eating or mindfulness or health at every size, those types of things. And they might think, okay, well, that's great for that person, but that's not for me because I have this health concern that really warrants, this other approach. And that approach isn't for me. The mindfulness thing isn't for me. Would you say that resonates with your experience?
Well, I think that, kind of that other approach, and if we could put it in broad terms, Paige, is restrictive eating. So one approach is being present with our food, which would be mindfulness based. And then the opposite of that would be restrictive eating. Now, restrictive eating is it's a fear-based, can't have approach to food and eating. And when we think about how the brain works, the brain is very alert to fear. So right away, when somebody says, you have diabetes, it's going to kill you. That would be a lot of fear. And so if somebody said, but if you ate this way and you didn't eat this and you cut out those and you were never to have that again, you would be healthy. Well, that would really address a lot of fears. First of all, it would give us assurance that this scary diagnosis, this scary condition could go away. And I am afraid as an individual, so I would want to do whatever I could to decrease my fear and also to preserve my life. So I think from a marketing perspective, fear is how people market change. But when we look at the studies, and there are a lot of studies, and these are huge, very well-funded studies, there's really no evidence that restrictive eating, that promoting weight loss, A, is effective, and B, is sustainable. So when we talk about restrictive eating with the intention to lose weight, we're lacking evidence. And when I say evidence, I mean long-term, applicable to somebody who is 45 or 75. Throughout our lifespan, can people restrict their intake long enough to have it have an impact on their health? And there is just a dearth of evidence to say, yeah, that's reasonable. And if we look at the science, and so the Look Ahead trial, huge, well-designed trial, it was stopped early because it was ineffective, and the research behind that showed that only 3.6% of people in the most intensive lifestyle intervention were able to reverse diabetes. So if we think about that, we'll round up to 4%. 96% of people in the most heavily, supported, intensive lifestyle change program failed. This study, the Look Ahead trial, a lot of people say, well, it did have some positive results, and that's in the short term. But when we talk about diabetes, does diet prevent diabetes? No, it's a chronic illness. It doesn't cure it. And that is something that's really hard for people. They say, well, I heard you could reverse diabetes, or I heard I could cure diabetes. And I go back to the marketing and I go, well, would you buy it if somebody said you couldn't cure it? Like, buy my product, it really won't work.
Yeah, exactly. That's not exactly a good marketing technique.
Not so much.
Yeah.
So what they do is they really layer on the fear. So they really layer on the fear, and they say, you have to do this. Your life is in jeopardy. And again, it's effective marketing, but is it accurate? And
right.
And so that's really, kind of one of the things that I try to talk about. As a diabetes educator, do I believe that lifestyle change is important? 100%. I do believe lifestyle change is important. As a dietitian, do I believe that nutrition is important? 100%. I believe that nutrition is very important. As a dietitian, do I feel that eating healthful foods promotes health? I do, 100%. Do I believe in movement and moving our body? I do, 100%. So if I've said all of these things that we typically associate with dieting, and I say I agree with those, why am I so anti-dieting? Why am I so anti-restrictive eating? And this is, I think, as we dig into this podcast, that's really the topic I'd like to clarify, really what the nuance is, what the message shift is.
Okay, perfect. And let me do a little bit of groundwork, and then let's move into that. So one thing that I just wanted to say from a broad perspective and kind of clarify is I'm always sensitive that there might be someone who's new to the conversations, the types of conversations that we have on this podcast. And it can be kind of confusing when people throw around intuitive eating and mindful eating, and like maybe will you just take a minute to kind of clarify, is there a difference if that's meaningful in context of what we'll be talking about today? How do you want to kind of define some basic terms so that people listening feel like they're on the same page with us?
Okay, well, that's a great question. So I come from the school that the present moment is not new. So I always believe that mindfulness, which is being aware of the present moment, came first. And then we start turning around saying, how could I use mindfulness? So when we think about mindfulness, I've defined mindfulness as having, it's being aware in the present moment. And so it's attention and intention. So my attention is tuned into what I'm doing, and my intention is directed towards compassionate self-care, self-kindness, and that, kind of an ethical, compassionate action towards myself and others. So my attention is focused in on the present moment, and my intention is rooted in kindness. So that's mindfulness. And if we apply that with mindful eating, we would say my attention is towards my food and eating, my body sensations while I'm eating, and my intention is to be kind to my body and select foods that are kind to my body and that would benefit my body. So that would be my definition of mindfulness, and then my subtle definition of mindful eating.
Okay, great. And my personal opinion is, for the intents and purposes of this podcast episode, because we will be centering our conversation around mindfulness, because that's really where your expertise lie. But just for the average layperson listener, all of the things that fall under the umbrella of mindful eating, I think, are also definitely still within the realm of intuitive eating, health at every size. All of these things can kind of go together, and maybe aren't interchangeable terms, but at least are on the same wavelength. I just wanted to clarify that, just if anyone was listening and wasn't sure where that fit into the big picture.
Right. Because I agree, Paige, I think all of those things really talk about kindness. They talk about being embodied or being in our bodies, trying to check in and being attuned with our eating. So those are the kinds of things we're talking about. And like you said, the scope of this is they're all trying to move us away from restriction and more towards self-care.
Okay, and that's the other thing I wanted to really quickly hit on before we dive into the topic. So we talked a little bit in the beginning. You were mentioning the idea of restrictive eating, and I think that there's a tiny bit of nuance that I just want to express here, because I really want this to feel as inclusive as possible for people. And you also did a beautiful job of talking about intentions and how important that is in the practice of mindfulness, and just in general, good quality, healthy self-care. We want to be thinking about our intentions. So I'm going to put this out there, and then I want to hear your thoughts. So I think that restrictive eating, how we're meaning it when we say that, is putting yourself on a certain diet that feels restrictive, you feel deprived, and it can lead to some of these cycles or the pendulum swing of restriction and then binging and then restriction. And maybe it's not always that extreme for everybody, but a lot of people will relate to that cycle of feeling kind of chaotic and out of control with all of the restriction. But I also want to make the point that there are legitimate needs for avoiding a certain food. And a lot of times people who have various conditions will kind of feel left out of the conversations about mindfulness or health at every size or self-care, because there are legitimate things that need to happen sometimes for health reasons or for an allergy or whatever it might be. So I think where this comes down to for me is what is the intention behind the restriction? Is it quality, good, grounded, kind self-care? Or is it rooted in punishment and deprivation and things along those lines. What else would you add?
Oh, I love how you phrase that. It's not the black and white, one or the other. It's on a continuum. And so most of the time our intentions are far from pure. And so I think that that's really what we start looking at. So I avoid certain foods for lots of reasons. I'm sure you avoid certain foods for lots of reasons. It could be that you just don't like the squeak of a mushroom when you eat it. That would be for myself. I don't like how mushrooms squeak when I bite into them. I avoid that because I find that to be inherently unpleasant to me. I don't mind the flavor. I just don't like the texture of them. So that's my picadillo. Fine. Now, restraint is when I look at something that I love and I think, oh, I love eating that. That tastes so good. It's so yummy. But I know that if I eat too much, it won't be yummy. It won't feel good in my body. So I use restraint, meaning that I eat an amount, but I don't overeat that amount. I think restraint is just turning around and saying, I could get carried away here. And that's normal. That's normal. It's applying, kind of the neuroscience would be, it's applying the brake, not letting our desires sweep us away.
Yeah, and I love that you said, I love that that model of self-talk that you just gave right there, where you said, oh, I know what this is. I know that I, sometimes want to eat more than feels good of this food, and that's normal, but I'm going to practice a little bit of restraint here. I think that kind of, I wanted to start with some of that groundwork because I think sometimes when people are listening to these conversations, they can feel like we're saying health doesn't matter or just eat whatever, just be present, So I think it's just really important to kind of help people understand what we mean and what our goals are. I think our goals are the same. I think we want to promote health and well-being. And I think that when, at least in my own experience, we see far better outcomes when we're coming from this place of kindness and compassion and presence rather than so much on the other end of the spectrum that I see where people are rigid and perfectionist thinking and punishing their body and things like that. And that's just, I think we just see better health outcomes and better mental health outcomes when we approach things that way.
Yes. And so when the motivation is internal, and it's an internalized motivation, I want to care for my body, you are going to see better outcomes than I have to care for my body or being told you should care for your body. So when it's external, somebody is imposing it upon you, you're going to see worse outcomes because it's not sustainable. And at a certain point, I think our inner teenager comes back out and says, I don't really like being told what to do.
Oh, yeah, that's so true.
Oh, yeah. And even though I'm in my 50s, my inner teenager is alive and well.
That's good to know. You never get rid of that inner teenager, huh?
No, I think we all have a bit of feistiness within us.
Which is a good thing, right? Helps us get stuff done and not take people's BS, maybe.
Yeah. So Stephen Andrews, he's a social worker up in Maine, and he's one of the teachers that I worked with. He has a great quote, and I'd love to share it.
Please do.
He said, "People don't resist change. People resist being changed."
I like that. Oh, that resonates so much with my lived experience as trying to, promote change or promote behavior change in the work that I do. It's all about helping people figure that out on their own, don't you think?
Absolutely. Absolutely. So I share that quote. I actually have a little caterpillar and a butterfly, picture of a caterpillar and a butterfly. We're always changing. And so this idea of I don't want to change, it's not accurate. You change all the time and you're seeking change all the time. What we're resisting and what we're spending a lot of our energy on is having people not change us. We get to drive the bus. We get to be in charge of our change, not anyone else.
Oh, that's such a good point. I love that. Thanks for sharing that. So tell me about how you got involved in doing diabetes education and diabetes work.
Mm. So my story is one of change. I used to work as a psychiatric dietitian in an eating disorder facility, and I really enjoyed that work. I worked with my patients for 3 to 4 months, and we ate together, and we just really had a great relationship. And then as insurance changed, as the world changed, my 3 to 4 months was dwindled down to 3 to 4 days. And if you have ever struggled or you know of anyone who's struggling with emotions around food and eating, we really know that 3 to 4 days working with somebody, it's just not enough time.
Absolutely, that's not very much time at all.
It's really not. And so I had to say, do I want to keep working with people who are, they still have eating disorders, but I'm working in a very acute, kind of enforcing and keeping them alive through, we call it hyperalimentation, but through IVs, or did I want to find a new job? And so I think you figured out I picked answer B.
Yeah.
And so I said, hey, what's a job where I could have a relationship with my patients for a long time? And so I decided to go into diabetes, and I've never looked back. I've loved every minute of working as a diabetes educator, and it's a great job. And if anyone's a health professional and they want to be a diabetes educator, shoot me an email because I'm recruiting.
Love it. So, talk about, I know we've already in the beginning talked a little bit about your thoughts on that weight normative approach to diabetes care, but let's just paint the picture for people. What's kind of the typical approach to diabetes, and just in case they don't know, and then let's talk about kind of where you're trying to paint the picture and where you're trying to blaze, or where you are blazing this trail of a different approach.
Right, right. So whenever we're diagnosed, and whether we're diagnosed with pre-diabetes, which would be that place where our blood sugars aren't really normal, but we're not actually having diabetes, and that can happen up to 12 years before the diagnosis of diabetes. And a lot of times people will come in and they'll say, well, I had gestational diabetes and I think I'm at risk. I know I'm at risk for developing diabetes. So those individuals, whether that's, a risk factor for diabetes, or people with prediabetes, or people with diabetes, whenever you walk through the door, you are who you are at whatever weight you're at. And so without going into trying to change or manipulate your size, there is a lot that we can do to help you prevent, decrease insulin resistance. So right there. So the insulin resistance, that's the hallmark of prediabetes. It's the big thing. And insulin resistance has been described and oversimplified to the point that it's no longer accurate. So what is insulin resistance? And this is kind of an approach that I take, and there's different ways, but I always think about insulin and what insulin does. So insulin is a hormone that moves glucose, which would be the food that you eat. So if you ate a piece of bread or you ate a piece of fruit, the fruit and the bread do not flow through your bloodstream. Digestion breaks the fruit into glucose. The digestion process will break down the bread into glucose. If we put maybe some peanut butter on the apple, it would take the peanut butter and break it into amino acids. It would break it into fatty acids. If we put some ham, or if we put some cheese on the bread, it would again break that into fatty acids and amino acids. So what floats in our bloodstream is glucose, amino acids, or fatty acids, and we need insulin to move that nutrient into the cell. And so when we understand, oh, insulin's job is to nourish the cell, I have a condition where my insulin, for some reason, isn't doing that. It's not actually moving nutrition from the bloodstream into the cell. And the analogy I use, it's almost like the insulin is dull, like a knife. It's like a dull knife. It's not working. So we want to think about ways we could sharpen that knife to make the knife more effective. How could I get that knife to work better? It's a fine knife. It's just dull. And that's really where mindfulness comes in, because we know that when we're stressed, we have a lot of behaviors that oftentimes increase insulin resistance, and we have a lot of stress response hormones and hormones that float through our bloodstream that make insulin resistance worse. And stress also has a huge impact on our sleep cycle. And there's an enormous amount of evidence to say if you're tired, you're less likely to go move your body and choose foods that take time to prepare or that are particularly nourishing because you're tired. You're saying, oh, I'm really tired. I'll just grab something. And so we fall into habitual patterns of thinking and acting that actually make insulin resistance worse. And so that to me is why mindful eating is so helpful, is to turn around and say, wait a second, let's sharpen that knife by reducing stress. Let's sharpen that knife by looking at the big picture and saying, this didn't come out of nowhere. This came from lots of conditions are making my insulin knife dull. And what are the ways that I could sharpen my knife?
I love that. That's such a probably different perspective than other people might have about mindful eating. They might think, okay, that's where I eat without distractions, and where that might be a good element of it. It's also talking more holistically about, yeah, your insulin will be affected not just by food, but also just by life and what's going on for you. So thinking about how a mindfulness practice will positively affect your ability to manage and deal and cope with stress in your life, and to be able to make choices that are ultimately in your best interest with sleep and with food and with exercise and all that stuff. It's just, I think that's a really good kind of way of looking at the power of mindfulness when it comes to diabetes specifically. Also, and it's important here to clarify, if anyone's listening who has type 1 diabetes, we're really more talking about type 2 diabetes, but there are also implications for mindful eating and mindfulness practice with, type 1 or gestational diabetes, or really any person anywhere health-wise.
Yes, I would agree. And I have a number of individuals with type 1 that turn around and say, some of what you're saying really is helping me kind of take care of myself. And I think it goes back to that intention. So as they start looking at, why am I making these choices? Oh, it's to take care of my body. And I understand that my body doesn't make insulin. That would be type 1. And I still want to care for it. Even though it's not functioning optimally, I, through deliberate acts, can really help it function better. And as a result of those deliberate acts, I feel better. I feel better.
Totally true. I love that. Thanks for going through that with us. So just to kind of summarize where we've gone so far. So the typical approach to especially type 2 diabetes is, someone goes in for their physical, and their doctor draws some labs, and maybe there's reason to check a hemoglobin A1C, and let's say the number comes back and it meets criteria for diagnosing type 2 diabetes. What's the typical advice someone in that situation gets from their medical provider?
Well, I think it really depends on your medical provider. I'm very fortunate. I work in an embedded healthcare system, which means that I work with it's 16 different providers, and they would say, "Oh, your blood sugars are elevated. I'm going to have you go see one of our educators," and we would coach people through, what does this mean, and what are the options that would work for you, and we would write those down and say, "So this is how you're going to manage your diabetes between." When you see the doctor, and kind of a nice way of thinking about it is it's your plan. So what's your plan? We develop a plan. And I think that to me, that system and that approach is optimal. A lot of people, though, aren't actually having a time to meet with somebody and talk about a plan and how to develop a plan. And I think that leads them to be vulnerable to marketing and to the comments of well-intending friends or an internet search, possibly the worst thing in the world, because then we're exposed to this fear. So people that love us, and they're afraid. And so they have a tendency to share with us more of the extreme thinking, more of those, well, you can't have any sweets, or you're not allowed to eat anything delicious. And those kinds of comments, though they might have the intention of being well intending, they're often very harmful and very, very triggering. If we do an internet search, we might get a lot of confusing misinformation that gets generated as well. So I think that meeting with somebody and really coming up with a plan and saying, what does this diagnosis mean? What should I do with this? To me is the best approach. And that will have you have a chance to have individual questions answered. So people will say things like, well, does this mean I can't eat white bread? Does this mean I can never have birthday cake? I'm like, no, it doesn't mean any of that. It means that we're going to develop a plan, food, activity. If you need medication, we're going to figure out what labs are going to need to happen. And then we're going to kind of put that all together and say, so this is your plan. Now that is working with me, and people will work with me up to 13 hours to get that plan established. So it's a commitment to really turn around and say, diabetes is a serious disease. Prediabetes is serious. I want to take it seriously. When they're diagnosed, are not offered that support. And so they kind of forge a path on their own. And sometimes that path is terrific, but more times than not, that path is cumbersome. It's fear-based. It feels very uphill. And they feel really alone and isolated and blamed. I caused this. Not true, but that is the messaging that comes from the media.
There's a lot of that. There's a lot of guilt.
Huge amount of guilt.
Mm-hmm.
And guilt dulls the insulin knife. And why does it dull the insulin knife? Because when I feel guilty, I am needing to cope with this very heavy emotion. How do I cope with it? It's not uncommon to turn to food. It's not uncommon for me to not exercise and to engage in acts of maybe self-indulgence versus self-care because I feel blamed. And diabetes, you didn't cause diabetes. Nobody turned around and said, oh, I'll go give myself diabetes today. No one signed up for this.
Yeah, that's such a good point. And just to reiterate, the kind of typical response people get is, okay, you have a diagnosis of diabetes, so make sure you exercise more and eat less. That's kind of a very typical response that people might get from a medical provider or from an internet search. So I think it's
the back of a cereal box.
Yeah, or anywhere. Yeah, that's true.
It's so ubiquitous. It's like a fortune cookie. What the heck does that mean?
Exactly.
What does that mean? It has absolutely, positively no meaning. We feel good saying it. I told him what to do: eat less and exercise more, and everything will be good. Lose 10 pounds.
Yeah, that's another one.
I don't know what that means anymore. And so it's so in the ethos. It's like the air we breathe. It's so omnipresent that it just doesn't make sense. And so what happens is this ambiguous, confusing messaging, we it gets latched onto, and somebody says, well, I'll teach you how to eat less and exercise more, follow my program. And their program is not tailored towards you. And their program talks about you restricting your intake versus saying, what do I want to change in my diet? What would work for me? So they're saying, eat this for breakfast, eat this for lunch, eat this for dinner, and you'll be better. And it's like, you could do that for a day, maybe a week, if you're super motivated, 2 weeks. But after 2 weeks of following somebody else's diet, you're like, I don't eat these foods. I don't like these foods.
Exactly.
And so you're going to be in the market for another diet, which is exactly part of the marketing strategy. Oh, well, give me $19.95 and you can try this diet, or, do this. And so it just perpetuates itself. And that's why the dieting industry it's like a $40 billion industry. And people with diabetes are so vulnerable to the messaging. And really, it's not sustainable.
Exactly. And again, like the goals that you and I both share that we have for our clients is we're trying to help them work with their body rather than work against it. And I think that message is particularly difficult for someone who feels like maybe their body's betrayed them and that's why they have this diagnosis, or maybe there's a little bit of a repair in their relationship with their body that needs to happen in order for them to tap into that trust and compassion, because often there's a lot of stuff to deal with just from the perspective of I feel guilty, I feel responsible, I feel ashamed, and yeah, there's so much to this conversation about diabetes that I think is fascinating from a social perspective, from a health perspective, mental health, self-care. There's just so many different facets of this particular diagnosis that I think is really fascinating, has lots of implications on how we care for ourselves.
It does. And you said something, and I'd like to kind of drill down a little bit on something you just said, which I think is really relevant. So when people talk about improving their health, the default is weight loss. So that is a really important paradigm to recognize. Oh, I want to get healthy, I'll lose weight. And that's not connected. Health and weight loss are not connected. That's a disconnect there. So weight loss is an outcome and health is a behavior. It's an action. How do I get healthy? I have to do something. What are the behaviors that promote health? Not what's the outcome? What's the behaviors? So being in the present moment, you can't do weight loss in your seat, but you can do what? Right now in this moment, well, I could eat and be more aware of what I'm eating. I could really try to taste the food. I could really, in this very moment, I could notice my hunger. I could notice my fullness. I could really sit down in this very moment. I could notice, what am I craving? What would really feel nourishing in my body? I could really spend some time and be with what is present. And that is a behavior that we practice. We start saying, oh yeah, I think that would probably help me if I really said, am I hungry? Am I hungry? Oh, I am. How hungry am I? That one little question, that little bit of curiosity changes everything about food and eating. And it's not restrictive. It's saying, I want to nourish my body. I want to put into my body food in an amount that feels good in my body.
In an amount that's not too much, but also like in an amount that's not too little.
Exactly. And that will change because if I exercise that day or if I wasn't feeling well, there's lots of reasons why I would eat more one day or why I would eat less the next. And so that's part of that trust that you said. And a lot of times, because we have been marinating in this diet culture, because the only time we think about eating healthy is restriction, there's a lot of unlearning that has to happen for many people with diabetes. They just really don't know what healthy eating looks like when you're not trying to lose weight. And I go, I know it's confusing, isn't it? So we spend
For sure. That's a really important point.
Yeah.
I just want to highlight that there can be such a feeling of confusion when your whole paradigm toward health has always been health equals weight loss or weight loss equals health. And when someone comes in and says, hey, those two things are not the same, that can be really confusing. And I think that's actually part of why the messaging of intuitive eating or health at every size can be confusing, because it feels like you're saying, well, if I'm not pursuing weight loss, then you're saying that I'm not eating healthy. And so how could a dietitian be saying that? So do you want to clear that one up for a minute?
Sure. So when we talk about health does not equal weight loss, I think that is a very, very important concept. So, the very first thing I would say is that health is complex. It isn't a single thing. So that's the very first step I want to say. So health, when we eat a healthy diet, it's a diet that has variety, it has moderation, it has, flexibility. It is a diet that nourishes the body and nurtures the body. And nourishes the body, yeah, it's got fruits and fiber and vegetables and a variety of food. And it nurtures the body. It tastes good. It's satisfying. It feels good. Those are the kinds of things that we want to include. It's not calorie deprived. It's calorie balanced. So when my energy level increases, my calories increase. When my energy, needs decrease, my calories decrease. And if I listen to the cues my body gives me, it will guide me to make those macro or micro adjustments to my diet.
You don't have to micromanage that.
You really don't, because you could say, oh, am I hungry? Oh, I am. Well, how hungry am I? How much do I need to eat in order to fill this current experience? And what would taste good? And what would fuel my body and feed my body? And, what would really nourish me? And it's a conversation, and it's a curious conversation.
And that's such a great point. I just want to highlight really quickly that circling back to that concept of why mindfulness can be a really powerful tool to practice with diabetes specifically is what you just said, those questions you just talked about, that you like modeling that self-talk. That's what you can start asking yourself when you create a little bit of a gap between stimulus and response, and you just pause and you ask yourself questions rather than just, that habitual reactivity that we talk about in mindfulness. So the questions of, how hungry am I? What would taste good? What would nourish my body right now? What do I feel like I need to eat to have the energy that I need to live the life I want to live today or in this moment? I think those are all questions we don't really ask ourselves when we don't take a minute to kind of take a step back and consider those things.
Exactly. So in the book that I wrote with Dr. Michelle May, Eat What You Love, Love What You Eat with Diabetes, she has a nice way of kind of breaking that down. So when we think about reacting, if you look at that word, it's you're reacting out the same response. So that's why we get into habitual patterns of acting and thinking, because when we react, we're reacting out the same response. We're doing what we've always done. And so when we put that pause in, we are pausing to turn and say, did my last attempt fix the problem? Did it work? I know it's familiar. I know this is how I typically respond, but did it work? Was it effective? And that is another reason why mindfulness and mindful eating are so powerful, because it's breaking out of reacting the same choice, and it's turning around saying, well, I chose this, and did it satisfy me or no, or did not work, or what would work better? What would be kinder?
Perfect. So I am going to ask you a question that I get a lot, and I'd be really interested to see how you would respond to this. So I'm imagining someone listening thinking, okay, this is great. I'm totally on board with the concepts of mindfulness and how powerful it could be in my relationship with food, especially given my diagnosis of diabetes, and they're all on board intellectually. But I can imagine that someone might be thinking, but for me, in my case, I need to lose weight first. And then maybe once I've lost the weight that my doctors told me I need to lose to manage my diabetes, then I will start working on mindful eating or all of this, like being kind to yourself and compassion stuff. Like I'll do that later. But for now, I'll just go on a fad diet.
Yeah, so there's a lot of different directions I could take. And the first one is be kind now. So when we think about our choices and we have a choice, and a lot of people say, well, I really want to be right versus kind. And I say, but if you're kind, you're always right. You know, you can be right and unkind, and there's a lot of consequences that come from that. But when you're kind, you're always right. No one's ever going to fault you for being kind. Now, that is really that's my compassionate response that I want to start with, is that self-kindness. It isn't like I'll do it tomorrow. Let's start now. There is no way to kindness. Kindness is the way. That's really kind of the intention that I have. Your body needs kindness now. It doesn't need it next week. It needs it now. And though we may approach restrictive eating or a fad diet as an act of kindness, in your heart of hearts, does it really feel that way?
Now, such a good point. Such a good point.
And a lot of people say, but I really need to work, I really need to do this now. I go, you feel a sense of urgency. They go, I do. I've got diabetes, like Migrit. I've got to do this now. I go, you're really worried. They're like, I am. I'm like, you want assurance that if you did something now, this would be taken care of. I do. I want assurance. I go, okay, how could food possibly give you assurance about a tomorrow that hasn't come? Oh, well, so what do you know works? What do you know you can do right now? What do you know you can do when you leave this appointment? And that, being present with our fear and our desires for assurance, which is human and normal, that is how we start the change process. That is how we really turn around and harness that desire effectively, not with fear.
That is such a beautiful point. And, you just illustrated a way to kind of be a safe place for someone to experience the really normal and even most of the time, very rational fears people have about, facing the uncertainty of a diagnosis of diabetes. And I think another great point you made that I just want to highlight is this idea of asking yourself what works. And you can go off of what other people say. You can go off of your own experience, but I would just encourage anyone listening to trust me and you, Migrit, because we both have had experience with seeing that actually what we're promoting and talking about here actually works, and works in terms of it creates more positive, healthier behaviors than the mentality of like, no, I just got to do it right now and I have to go on this crash diet. That's actually not as healthy long term.
Right. And when we fail at this crash diet, which we will, because they don't last, or when we white knuckle our way through it, we realize that we're sacrificing other things in our lives that probably have far more meaning, whether it be walking the dog or being with our partner, those are the kinds of things that really nourish our being, but we're sacrificing those to follow this very rigid plan.
And ironically, we're not healthier for it, right?
We're really not. So you had kind of talked about how do we look at the change process and do it in a way that, to trust us. So I wrote a book called Discover Mindful Eating for Kids, and it really was saying, well, how could parents teach kids about change? And so I spent a lot of time thinking about it. And I'd like to share with you kind of a way to approach the change process. And it works for kids, but it works for adults. So the first one is discover. Don't when you start a change process, just say, what can I discover about this thing that I'm dealing with? So we're dealing with diabetes. What could I discover about diabetes and how to change? Okay. So you might turn around and say, well, I discovered this mindful eating business. That's kind of interesting. Okay. It's stuck with you. Great. So the second step is to explore. Let's explore mindful eating. What would that mean? What would that look like? How would that look like for me? Who would I want to talk to? What questions would I want to ask? That's the exploring process. You're kind of digging in. So you're digging in a little bit. You're exploring. Okay. Next phase is play. How could I play with mindful eating? I might try it for breakfast. Maybe I'll try it for lunch. Maybe I'll try it as an appetizer. I'm going to try it in lots of different ways. I'm going to play with it. Oh, well, I could make this really fun thing, or I could do this really other thing. But play is joy. So really play with mindful eating. And once you've discovered it and you've explored it and you've played with it a while, you will naturally say, I am going to challenge myself to eat mindfully for breakfast, or I'm going to challenge myself to, be more mindful at lunch, or I'm going to be more mindful about my meal planning or my shopping, or, what I eat after, X time. So you then challenge yourself, and you might say it's a gentle challenge. And then you start the cycle over again. Oh, what did I discover from this challenge? What do I want to explore more? How could I play with this concept a little bit more? And then we naturally challenge ourselves. So discover, explore, play, challenge. Discover, explore, play, challenge. It's just a nice way to move through a change process. It's not heavy, very light and friendly.
I like that. And I think that can be so relevant to so many different people listening. And also one of the things that I wanted to mention is sometimes mindful eating, especially in context of maybe diabetes, for example, can kind of turn into another diet. I mean, we're really good in our society turning stuff into diety approach where it's the right way to do it, the wrong way to do it, you're failing or you're succeeding, we can get very rigid about this stuff. So will you just take a minute to provide some advice for how to avoid the pitfalls of turning mindfulness and mindful eating into yet another diet?
Right. And so the diet voice, and I appreciate you saying that, Paige, so thank you. The diet voice is the voice from outside. It's external information, and that can be people, but it's external. It's the theys, them, those people, I've been told. It's all outside. So whenever we have that external voice telling us how we should be, who we should be, or what we should be, that is going to really fuel a restriction or a diet mindset. That's going to fuel diet culture. When the voice is internal, what do I want? What do I need? What do I have? What are my desires? What feels good in my body? What's my current experience? How can I be more compassionate to myself? That's internal information. And that actually fuels mindfulness. That fuels self-compassion because we are becoming curious about ourselves, about our needs, about our wants, about our current experience. And that is really where change happens, is our curiosity about our own experience.
Yeah, that's such a great point. So there are infinite misconceptions about diabetes. There are also infinite misconceptions, I think, about this sort of compassionate approach we're talking about. And you've done such a great job of occupying this intersection along with others who are trying to start this conversation or continue this conversation about how there is room for compassion and kindness and self-care along with a condition like diabetes. What would you like? What do you wish people knew, I guess, about that intersection? What misconceptions do you want to clear up? I know you said in the beginning you wanted to dive into that a little bit. So talk a little bit about that, and maybe I'll guide you through some questions.
Okay, sure. So I think the first misconception is that when we talk about diabetes, that people think it's a simple cause. So that's the first one. Diabetes, type 2 diabetes, it's genetic. Um, and then there are conditions that occur that can make that genetic predisposition kind of manifest or unfold. So, using myself as an example, there are people with diabetes in my family. It's a genetic link. So I genetically am at risk for developing diabetes. I know that. Now, that is part of it. Now, if I live long enough and certain conditions happen, that it's very likely that diabetes will present. So that's just what happens. But the reason why it presented wasn't because of my weight. It was because my insulin production decreased, my kidneys are reabsorbing glucose at a higher rate, my muscles are not utilizing glucose, my liver is releasing glucose more at night. There are 8 or 12 different core defects associated with type 2 diabetes. So this whole idea that it's just caused by what you weigh, it's erroneous. It's not accurate. And Dr. DeFranzo, really talks about the ominous octet, which really kind of helps us understand type 2 diabetes is a complex disease, and it does take time to understand it. And it's okay that we're confused because doctors are confused, researchers are confused. So, people who are listening that don't have a medical degree, hey, welcome to the club. We've been scratching our heads about this disease for decades. So that's the first misconception, is that I should know this, or I should have prevented it. That's the first place I'd like to say, well, if you could have prevented it, or you do understand it, there's probably a Nobel Peace Prize for you for that in medicine. So, that's the first one.
One thing to add to that really quick is I think we can do better at trying to not blame ourselves when and if we get a diagnosis of diabetes, but also culturally, I would love to see a shift in how we treat each other, and how we talk about this disease in general, because there often so much of the fear of, or the shame or the guilt about diabetes is associated with what will other people think, because they'll all assume that I did something wrong. And so I think if the cultural conversation could shift, that would be incredible, and I think really, really helpful.
Right. And I think what you're talking about right now, Paige, is this concept of weight stigma, that being fat is bad, and that there's a lot of negatives associated with our weight. And the reality is that type 2 diabetes affects people of all shapes and sizes, and that this notion that living in a larger body made you bad or made you unhealthy, again, is part of the weight stigma that I would love to change around diabetes care.
So I'm talking about weight stigma, but I'm also talking about, someone in maybe a culturally accepted body who gets a diagnosis of diabetes. I've also seen that cause a lot of shame and guilt, because people are nervous about the implications of getting that type 2 diabetes diagnosis, regardless
Right.
of body size.
Right, right. And so that's another, layer, which is again just that blame and shame piece. Um, so I agree. I think that weight stigma, weight bias, all of those things they drive us to cope with food. And so it actually fuels disease, because when we're judgmental towards ourselves, when people express that, judgment or harsh criticism towards ourselves, it also can fuel us seeking ways of coping. And, that could be food, it could be alcohol, it could be, binge watching Netflix. There's lots of ways that we cope that actually don't promote health.
Very true. Okay, so what you were about to talk about, another misconception.
So I think the first one was we oversimplify diabetes. We deal with a society that has a lot of weight bias and weight stigma, and weight bias and weight stigma fuel coping. And typically it's alcohol and food are our primary methods of coping, and that we really need to work on identifying what are effective ways, non-harming ways that I could cope with a stressful life, with a stressful situation? What could I do that won't harm me? And that's really an exploration of, what would work. So I really need to discover what are my options, and I need to explore those, and I need to play with different things. So maybe it's a hobby, maybe it's exercise, maybe it's meditation, maybe it's, drawing or art or singing. But there's lots of different ways that we can cope that don't create harm. And I feel like restriction, going on a diet and trying to be good, is how people cope. And in fact, it fuels disease. So just kind of recognizing that people are like, well, I'm going to get healthy, I'm going to go on this diet, or, I'm really stressed out, so I'm going to go on this diet. And I don't think that that's healthy. I think eating healthy is healthy. I think managing our stress is healthy. I think moving our body in joyful ways is healthy. I think getting enough sleep is healthy. I think taking our medications as prescribed, that's healthy. Those are all healthy behaviors. But restriction and kind of putting ourselves in this very small box and telling ourselves, I can't eat this and I can't eat that and I can't have that and I can't have that and I shouldn't eat that and I'm not allowed that, that actually doesn't promote health. That creates disease. And it's dis-ease, as in, I don't feel my life is easy.
Love that. Really good point. And such an important thing to try to kind of clear the air and talk about what these misconceptions are and maybe why we're missing the mark in some of our traditional ways of approaching this stuff. And again, there's so many parts of our medical system that are just tough. There's not a lot of time. And you're mentioning how it takes around 13 hours in session with you to really solidify a plan. Doctors, medical providers don't have anywhere near that amount of time. And so it does make sense that sometimes we boil this down and oversimplify and give advice that we think will be good advice, but maybe don't always understand how it sinks in for the person listening. So I'm hoping that this conversation is helpful for people listening, whether you're on the patient side of things or if you're on the provider side of things, just to understand, like, there's some elements of how we talk about this that could be so much more effective and helpful and health promoting long term if we really talk to people about, their whole selves and about this practice of mindfulness ultimately and compassion.
So well said. So
what else do you want to add? I'm always sensitive that, conversations can feel a little jumbled, and I'm hoping I did an okay job today, but tell me, what did we not cover that you want to make sure to talk about today?
So I think the resources, there's a couple of different resources, if I can just touch base with those. So I see patients in a closed network, so you have to be a patient of the docs that I see. So it's not like people would call me up and say, "Oh, Migrid, I'll have an appointment with me." If you're in our network, you could, but it's not like I have a private practice. I work in a medical setting. So really turning around saying, well, who would I see, or how could I find an educator? I'd like to spend a little bit of time just to kind of guide you towards kind of seeking services so you can get the help you need, so you can get that diabetes plan in place, and you can really feel that support. So that would be something that would have a lot of value if we could talk about that. So the first suggestion that I have is it's okay to work with somebody to figure out the diabetes. Give yourself permission to not know.
It's a great point.
Yeah. So I think that that's really, really helpful. So many times people say, well, I should know all about diabetes. Why? Why should you know about diabetes? I probably take like 45 or 50 hours of continuing education every single year to keep my brain up to date. It's a complex topic. Please don't feel like you should know this. It's hard stuff. So give yourself permission to not know. The second step I would say is give yourself permission to develop a reasonable plan. So don't grab, something pre-printed and say, oh, this will be good enough. So give yourself permission to say, you know what, maybe I don't have time to deal with this right now, doc. What could be 2 things I could do until I can go meet with, somebody and work out this plan. And I'm sure the doc would be able to provide you with something, and there's some resources at Am I Hungry? So you can click and go to Am I Hungry? If you don't have a doc that can provide you with anything, there's a couple of resources on that website which you can get, which I think are very helpful. So when you have the time, turn and say, okay, nobody plans to have diabetes. I get a busy life. If somebody said to me, oh, by the way, Margaret, you have diabetes, I'd be like, okay, 6 weeks from now I can tackle this, but I need 6 weeks ahead, before I can really address this. I might ask for what can I do in the interim to kind of get that space. But that 6 weeks comes, and I really want to put together my team who is going to help me understand my diabetes. So there's lots of different people you could have on your team: dietitian, diabetes educator, life coach, a trainer if you're in that place where you can have access to a trainer, a therapist just to talk about things. There's lots of things that come up about diabetes, and of course a doctor to help you with all of that. So recognize that everyone's going to kind of have their own little spiel and stick that they're going to be interested in, but you can work with lots of people. Pharmacist, I work very closely with a pharmacist, and she's terrific. She clears up a lot of misinformation about medications and really value her time. So you're going to have a team, and that team, and this is a covered benefit if you have Medicare. So it's part of the normal process. This is not something out of pocket. So if you're over 65 and you have Medicare, you get this as a covered benefit that you should access. And only 5% of people with Medicare access their benefits. So if you have commercial insurance, most of the time you even have twice as many benefits or 3 times as many benefits. So talk to your insurer and say, how can I get this covered? Because this is really important to me. When you seek services, really have your medical providers really talk to you and share your values. So if your medical provider is telling you to do X and you think, well, I don't value X, or that isn't, how I want to approach this, find somebody who will work with you. For myself, I am a health at every size dietitian, diabetes educator. I value that position. So if you go to Health at Every Size, you can find practitioners that do that. So find a dietitian, a diabetes educator. If you say, I don't want to diet anymore, I'm done with diet culture, find somebody that supports that message. I think really craft your support network. This is the people that are they're gonna keep you going when it's hard.
Get that team on board. And don't be afraid to ask for help. And I love that you explained so eloquently the idea of sometimes you just need to try to give yourself the chance to try to learn what diabetes even is. Because there's
absolutely
and I think you can't discount that, because understanding what's going on in your body can also be helpful for you to understand what you need to do to care for it.
Absolutely. I know it's helped me a lot, and it really helps me be compassionate as I understand, like, oh my gosh, my poor body, think about what it's trying to do. Of course I want to be nice to it, because it's the only one I have, and that poor body is trying to do all this work with a really dull knife. That would frustrate the bejeebas out of me if I had to digest and utilize all this food with a dull knife. Not to mention that it's not particularly a big knife either. So, as we create empathy for our body, it's really important. But supports are so important. Support groups, podcasts like this, but really getting those supports in place so you can turn around and say, I don't have to change my body to care for my body. My body, as it is right now, deserves care and kindness.
Such an important point. Love that. How can people listening keep in touch with you or follow your work?
So Migrit.com is my website, and that's just my first name. And then if you're a professional, because I work with clients, through my day job. But if you're a professional, I have more resources for professionals at Migrit.com. I did write a book with Dr. Michelle May called Eat What You Love, Love What You Eat with Diabetes. And that's available at Amazon or in your local bookstore. It's a comprehensive approach to diabetes care using a mindfulness-based model. And Dr. Michelle May has a great website called amihungry.com.
Great, such important work. Thank you for sharing all of that. And thank you again so much for spending so much of your day with me today. This has been such a great conversation, and I really appreciate your time.
Same here. Thank you.
Well, I sincerely hope you've enjoyed this conversation. If you haven't already, please go ahead and leave a review on iTunes. Thanks again so much for listening, and we'll see you soon for another episode.